This short video is on the rehabilitation of carpal tunnel syndrome. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section at the beginning and go straight to the rehabilitation exercises. Sophie, on this presentation, we're going to deal with carpal tunnel syndrome. And it's quite a common condition affecting more women than men.
And what causes this syndrome?
Lots of different causes. In most cases, perhaps it's kind of RSI, repetitive strain injury, whereby you're doing something a lot repetitively, like, for instance, keyboard work, playing the piano, or a particular sport. So that repetitive work could cause irritation. At the front of the wrist, you've got a tough fibrous band known as the flexor retinaculum, which looks something like this. It's like a band, like a collagenous sheath that supports the hand at the front. The nerve has to go under this structure to supply the hand. The nerve is actually the median nerve, which comes all the way from the neck, goes down the hand, and then it goes under this ligament to supply the front of the hand, and especially around the thumb area. So as this flexor retinaculum, this ligament, becomes tight, it squeezes the nerve, causing the symptoms. It can also be seen in people that gain weight, the obese. It's also seen in pregnant women, and sometimes it's transient. It goes away by itself without surgery. Maybe it's to do with the fluid retention stages of pregnancy and so forth. It's also seen in some systemic conditions that have inflammation as their cause, like rheumatoid arthritis. Usually, if it's one hand affected, it's to do with mechanical causes. But if both hands are affected symmetrically, then we should also think of an endocrine condition known as underactive thyroid. And again, that is seen more in women, where there is less secretion of thyroxine that causes congestion in the tissues and carpal tunnel in both hands. Yeah.
And what are the effects of carpal tunnel?
So in the beginning, when the compression is subtle, then you get tingling, pins and needles, sensory sensations basically around the hand, but no changes to your grip or strength. But as the compression continues to get worse and worse, then you are losing the grip. Then the muscles become atrophied and weak. And at that stage, you really want to go and see a specialist. You don't want to allow that to progress. In severe cases, there is surgery that can be done to release it. Injections are put there to reduce the inflammation. But if it's a mild condition, then maybe some exercises and rehabilitation might actually improve the condition. So we're going to cover some of those today, yeah? So simple things like, basically what we're aiming for is to stretch that area.
Right.
So that is a simple stretch, keeping the arm completely straight, pushing the fingers downwards, tension. Again, don't put undue force and then cause injury to your wrist. Feel the stretch taking place along there. By keeping the arm straight, you can actually feel the stretch all along the nerve distribution, the median nerve, plus the ligament here, the flexor retinaculum. Release it a bit, and then increase the stress, and release it a bit, and then again. We can also do the reverse now. We can stretch the outside aspect. So you did that. How about not doing that? Yeah. Hold your hand. So we're stretching the outside just to get the whole wrist a bit more flexible, keeping the arm straight. So we're stretching the extensor muscles as well. Yeah. Because when we're doing that, we're also stretching the flexing muscles. Now we're stretching the extending muscles. Good. You can also do this simple stretch like a prayer position. Push them together. In fact, it's one of the tests we perform. Push them together and lower them down a bit. Hold that tension there and then relax. Mm-hmm. Yeah, you can feel the tension there, and then release them, and then again, push them together. Then the reverse, you can do that. Push them together. Start from here, and then as you go upwards, increase the tension, and then go back down, and then again. Now, other things you could do to release the congestion in the wrist is doing some hand exercises, preferably with the hand elevated. So hold the hand up and do some flexion and extension of the hand. Other exercises to reduce the pressure is elevating the hand high up and doing some fists and then extending the hand. Squeeze the fist, Extend the hand like this. What you're doing, you're pumping any excess fluid out of the area into circulation, reducing the pressure. Especially in the morning, people with carpal tunnel, they say it's numb in the morning. There's a bit more pressure in the morning because of fluids. So elevate the hands and do some exercise like that, yeah? Or you can even take a ball and squeeze it when you're doing that as well. So put it in your hand, give it a squeeze and relax, yeah. Even more effective. The next one is moving the wrist in all its directions according to its anatomy. You can do flexion, extension, you can do side bending either way. So keep the hand up like this. First with the hand straight, bend it towards the little finger, bend it towards the thumb, bend it to the front, bend it to the back. And you can also do kind of circular movements like that. It frees up the wrist there, yeah? Circular movement. Do the same again with the fist now. So one side, the other side, front, back. Obviously, when you're doing this for real, take a bit longer and pause at the end as we've been doing for maximum effects, yeah? Good. The next one is similar again, doing flexion and extension of the wrist, but holding onto a ball. That puts different tension on the muscles. Hold onto that and do some flexion. Keep your hand a little bit up so that we can see what's happening. Maybe rotate a little bit this way, yeah, and backwards while you're squeezing. Keep the squeeze, yeah? Yeah, it's hard, isn't it? Yeah. And then keep the squeeze and down and then up again. Good. Thank you. Part of the rehabilitation program is to stretch not just this individual area here, which is the problem, but go more broadly than that. Stretch the flexor muscles all the way up to the neck. So, but also by doing that, we want to stretch the median nerve, which is embedded in these muscles all the way up. So one of the stretches is opening your arms outwards, pushing the wrist backwards like that, and pushing it backwards. Do you feel the stretch at the front? Yeah? Yeah. You might even get some tingling sensation in your fingers when you're doing that. That's because your nerve is being stretched and it fires by itself. Yeah. Do the same one with your arms elevated. Feel the extension all along here. Continue in that position and raise your arms over your head, keeping your fingers towards your head. That's it. And you're also stretching the whole shoulder complex as well. Now let's stretch the area where the nerves are emerging, which is basically the sides of the neck. That's where the nerves emerge and they make up the median nerve. So one stretch for that is to engage your hands together at the back. As you're doing that, you're pushing them downwards, down, 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 and then backwards, like that. And then you slight chin upwards, not too much, like that. So face this way. So basically what we are doing, face a bit more like that. What we are doing, we are opening up what we call the brachial plexus, an area of several nerves which contribute towards the median nerve. Yeah. Okay. Another exercise for the brachial plexus to stretch that is to put one hand behind you like that, the other bring it over your head, but I don't want you to pull your neck in a kind of a vicious manner. Just a gentle tug to the side, keeping that arm behind you so you can see now you're stretching that side there, keeping that hand right back so that we're opening up the side of the neck. Good. Continuing the stretch now with the neck area and the brachial plexus and the nerves that contribute towards the median nerve is locking your hands behind you, pulling them downwards so that we keep the shoulders down, and then do some side bending with your neck. Obviously, it's more limited now because we're pulling downwards, but that's more effective. Hold on to that, and then do it to the other way. Good. You should feel the stretch in the opposite direction. The next one is a pectoralis stretch. Again, it stretches the median nerve. Have your hand on the wall, flat against the wall. The fingers pointing backwards, and you're going to rotate slightly that direction with your torso rather than with your head. That's it. Where do you feel the stretch? All along here. Okay. By keeping the elbow straight, you are also stretching the median nerve at the front of your arm. Yeah. Good. The next exercise, Sophie, is very similar, but we're going to use the towel to assist the stretching of of the sides of the neck. So you're going to put the towel along your neck like that. You're going to hold it with one hand there, and with your other hand, maybe this one at the back. What do you think? Okay, so I want you to pull the towel downwards, and as you pull it downwards, you bend away from it. So we're opening up that area there, stretching the sides of your neck. That helps the overall mobility of the neck, but also of the scapula, the whole shoulder complex as well. And again, as you pull down, you side bend away. Now, Sophie, if someone has been suffering from carpal tunnel for a while, the hand becomes weak, the fingers become weak, you end up dropping things. So we need to maintain the strength, and we need to regain the strength. Maybe you had an operation, now you're in the recovery phase, and using a ball just simply to squeeze is one directional kind of exercise. We're just using the flexors. We need to challenge the other muscles, the abducting muscles and the adducting muscles and their positions. So something like this actually helps you to do that. You put your thumb in there, like that, and you put the other fingers in each of these loops. So what you're doing, you are squeezing, hold it, count to 3 if you can, relax. But now we're going to do the extensors. You're going to push the loops of the bands of the elastics backwards. So you see now you're actually engaging muscles that you've never engaged before with the ball. And now you squeeze. So you're doing the flexors. Now you're doing the extensors of the fingers, which are very important. But also we can do some abduction of the fingers. Pull the fingers outwards. When you extend the hand, open them out, flare them out, and then close them, and flare them out. Keep doing that for me so that we do that particular. That's it. I want you to actually open them out as well as backwards. That's it. And then allow them to recoil. And then, yeah, if you have carpal tunnel, this muscle gets very weak. In fact, this muscle called the thenar eminence becomes wasted, and you can see it becoming quite thin. So this one will help you build that muscle, yeah? Sophie, the next exercise in releasing the muscles of the forearm, it involves using some of these devices. This is a small roller, a spiky ball, and so forth. So you need a table or a surface to rest your arm. So have a seat here for me. What you like to do is put your hand on the roller, and without too much pressure, just roll it up and down. And then gradually, when you are ready, increase the pressure. Make sure you do the whole distance of the forearm. And then what you can even do is put your other hand on top of it, put more pressure on it so that we have more resistance there. How is that? Yeah. You can use a ball for that as well. It doesn't have to be a soft, spiky ball. It could be a uniform, smooth ball. But let's try this one. Again, do a small area first. Yeah. And if you want, you can stabilize it with the other hand so that it doesn't roll away. Yeah. Part of the rehab program for the forearm is to do some what we call eccentric exercises, whereby you assist your hand to take the weight up, and then you allow it to drop down. So basically, you have a weight like this, you allow the weight to drop down to extend your wrist, assist it upwards to the top, and then allow it to drop down all the way. Okay. Now, if the weight is too much, obviously take a weight that is manageable. This is 2 kilos, say. Allow the wrist to extend fully all the way. Bring it up towards the full flexion, and then allow it again to drop down. This is what we call eccentric exercises. Yeah. Another way to improvise with that is to use an elastic. We hook an elastic and you grip it in there, not too tight. It might be a little bit too tight, but the same principle applies. You assist it upwards, and then you allow it to go downwards. Like that. So you touch the elastic maybe under your foot or something like that. You step on it. So allow it to extend fully, and then assist it upwards. Finally, this exercise challenges the extensor muscles. I know this is not the area where the original syndrome began, but because you haven't been using your hands, say, probably for a few weeks, most of those muscles will become a little bit dysfunctional. So we need to make sure that all the muscles are working well. So I want you to grab the elastic and hook it maybe on a surface or under your foot. And you're going to extend your wrist upwards as much as possible, count to 2, and then go back down. Again, choose an elastic band that is within your limits, hold on to it, and then go back down. You can see you're engaging the extensor muscles there. After you've done strengthening or engaging exercises, what is a good idea is to do some stretching, always at the end. So whether it's the simple stretching like this, or like that, or at the front, or like that, all of these open up the carpal tunnel like that, yeah? If the area is inflamed and sore, don't put heat on it. Put a cool pack rolled up in a towel, press something cool there. And then when you remove the cool pack, just give it a bit of a rub to disperse the cold blood from that spot there. You may be advised to put anti-inflammatory creams. Again, you need to get advice from whoever is taking care of you, whether you can put some diclofenac or ibuprofen or whatever to see if you can take down the inflammation. So, thank you again for volunteering. Carpal Tunnel Syndrome. Additional management advice. Try wearing night splints. The application of anti-inflammatory creams. Cut down on salt intake, that is to help reduce fluid retention. Reduce pressure at the wrists, especially with PC or mouse work. Use a hand exerciser such as the Hand Master Plus. If you're obese, try losing weight. Do regular exercises such as yoga. Elevate the arm and do repetitive fist clenching. And perform nerve gliding exercises. Eccentric exercises definition. These are active movements that lengthen the muscles, which are unlike the passive stretching exercises. It's a type of strength training that targets specific muscles to control a weight as it moves in a downward or away motion. An eccentric contraction is the motion of an active muscle while it is lengthening under load.